Imagine feeling a mysterious pain that won't go away. You've tried rest, home remedies, maybe even medication, but nothing has helped. Your doctor mentions a CT scan. Now, you're wondering, what exactly is a CT scan, and how does it help figure out what's wrong inside the body? A CT scan is a powerful tool that can show us what's happening beneath the skin without the need for surgery. This advanced technology provides a clear and precise image, revealing vital information that could change the course of your treatment. But before you head to the hospital, there are some key things to know about this procedure, from its benefits to any risks. Let's dive in and explore what CT scans can do for you. What is a CT scan and how does it work? A CT scan, short for computerized tomography, uses X-rays to create detailed images of the body. Think of it like slicing a loaf of bread. Each slice gives a cross-section that reveals what's inside. A CT scan produces similar slices of your body, and these can even be combined to create a 3D view of your organs and tissues. While traditional X-rays send just a single beam through the body, CT scanners use a series of narrow beams that rotate around you. These beams pass through various tissues at different angles. A computer then analyzes the data to create clear, layered images of your internal structures. Why might you need a CT scan? There are many situations where a CT scan is invaluable. It's especially useful in diagnosing conditions like cancer. A CT scan can reveal the size, location, and spread of tumors, giving doctors essential details for treatment. Head injuries. A quick scan can show bleeding or swelling in the brain following an accident. Organ damage. It's often used in emergencies to detect damage to organs, such as the liver, kidneys, or spleen. Bone fractures. For complicated fractures or injuries, a CT scan shows tiny bone details better than regular X-rays. In short, CT scans provide a window into your body, helping doctors diagnose and plan treatments with remarkable accuracy. The CT scan process. What to expect. Before your scan, your doctor may advise you to avoid eating or drinking for a few hours, especially if a contrast dye will be used. The contrast dye, often ingested or injected, helps highlight certain areas in the images. For example, if you're getting an abdominal scan, you might drink a barium solution. If blood vessels are the focus, the dye will likely be injected. On the day of your scan, you'll likely change into hospital gown, as metal and other materials can interfere with the machine. You'll lie on a table that slowly moves into the donut-shaped CT scanner. During the scan, it's important to stay still. Any movement can blur the images. The entire process is painless and usually takes just a few minutes. For those who feel anxious in small spaces, talk to your doctor. There are ways to help you feel more comfortable, like relaxing medications or gentle breathing techniques. How safe is a CT scan? Understanding the risks. Radiation exposure is a common concern, and CT scans do involve a small dose of ionizing radiation. However, the amount is carefully controlled and is often comparable to the natural radiation we encounter over several months or years. The risk of developing cancer from a single scan is very low, less than 1 in 2,000. It's worth remembering that medical professionals carefully weigh the risks and benefits before recommending a CT scan. If a CT scan is advised, it's because the potential health insights far outweigh the minimal radiation risk. CT scans versus MRIs. What's the difference? CT scans and MRIs are often confused, but they're quite different. While CT scans use X-rays, MRIs use magnets and radio waves to capture images. Here's a quick comparison. CT scans, best for visualizing bones, chest, lungs, and detecting cancer. Quick and ideal for emergency cases, like trauma. MRIs, superior for soft tissues, tendons, and ligaments. Ideal for brain and spinal cord issues, but takes longer than CT scans. Your doctor will choose the best option based on your specific health needs. After the CT scan, understanding your results. Your doctor or radiologist will analyze the images to provide a diagnosis. The CT scan can reveal structural abnormalities, such as tumors, blood clots, or bone fractures. By seeing what's inside, doctors can better understand the problem and recommend the right treatments. In some cases, a CT scan can help determine if additional tests are necessary or if a particular treatment will be effective. For example, if a tumor is detected, the CT scan provides precise information on its size and location, which is crucial for planning surgery or radiation therapy. Addressing common concerns: pregnancy, allergies, and claustrophobia. If you're pregnant, or even think you might be, let your doctor know. Although the risk to the fetus is extremely low, it's always safer to take precautions. Sometimes, doctors may suggest an ultrasound or MRI instead. If you have allergies, particularly to contrast dyes, it's essential to discuss this with your doctor. Reactions are rare but can happen. They may provide a medication beforehand to reduce any risk. For those with claustrophobia, know that CT scans are typically much quicker than MRIs. However, if you're nervous, inform the staff so they can make adjustments to help you feel at ease. Key takeaways: what you should remember about CT scans. CT scans are powerful diagnostic tools that have transformed the way doctors understand and treat various medical conditions. Here's a quick recap of the key points. 1. Quick and detailed. A CT scan provides detailed images of bones, organs, and other tissues, helping diagnose conditions accurately and promptly. 2. Low radiation risk. Although CT scans involve radiation, the risk is minimal, and the benefits often far outweigh any potential harm. 3. Contrast agents help. Sometimes, a contrast dye is used to improve image clarity. Make sure to inform your doctor of any allergies. 4. Versatile tool. CT scans are invaluable for detecting cancers, organ damage, fractures, and more. 5. CT versus MRI. Each has its strengths, so your doctor will recommend the most suitable option for your condition. Remember, CT scans play a vital role in modern medicine by offering a non-invasive look inside your body. Whether you're dealing with a serious health issue or just want peace of mind, this technology provides critical insights that can make a big difference in your care. Thanks for watching. If you found this video helpful, be sure to like and subscribe for more health insights. And as always, consult your healthcare provider to determine if a CT scan is right for you.